Hello, welcome back to my channel. Today we are going to share 5 myth busting facts regarding osteoarthritis knee with you. In India, osteoarthritis is a very common degenerative condition and it is very common among females who are aged above 55 or 60 years. Why it is so common? There are so many factors which contribute in the process of osteoarthritis. And so I think creating awareness regarding the factors which influences this thing is very important, because in the process of management the first thing is patient education. If you understand the condition, you can manage it very well. So number first myth is knee osteoarthritis is a normal part of aging. Well, as you grow up, as you age up, actually, your joints are going to be degenerated. And this is a physiological response. But remember, degeneration is an aging process, but osteoarthritis is not. You can actually influence the process of degeneration by some factors. And hence, we categorize these factors into two subcategories: the modifiable and unmodifiable factors. Modifiable factors are those which you can actually modify, like your body weight, muscle strength, joint flexibility, your psychological status of how you will manage the body as you will age, and some unmodifiable risk factors like your sugar, your cardiovascular condition. If you are having some genetic predisposition to conditions like that, if you have some previous trauma to your joint, you can definitely does not influence it. But if you can prevent the modifiable risk factors, you can definitely delay the process of symptoms which comes because of the degeneration. There was a study conducted upon 5,000 people in India, and this study was conducted not only in the metro cities but also in the small cities, some towns and villages as well. And they found that if someone can control over these factors which can be modified, definitely the pain, the stiffness, and the functional impairment can be delayed. Number two myth: walking aggravates osteoarthritis. Well, walking plus exercise actually relieves osteoarthritis. Although in some cases we see that if the arthritis is in the severe stage, if the person walks too much or if the person exercises even a bit, the pain gets increased. But if you are in the earliest stages of osteoarthritis, or if you are having stiffness in your joints, or you are having some muscle weakness in your joints, you can definitely go for a brisk walk or some slow walk. And it depends upon your health condition, your general health condition. Ideally, a person is advised to walk for almost 15 to 20 minutes daily at a low or medium pace and exercise the muscle which helps in stabilizing your core, in strengthening your thigh muscles, which stabilizes your back muscles. And hence, it is proved that exercise and walking together actually benefits the patients of osteoarthritis. It does not aggravate the condition, but everything depends on the dose, how you are doing it, how your body is responding to it. Number three fact is knee braces can cure arthritis, or some people believes that if you use the braces for a longer duration, it actually weakens your muscle. Studies shows that some shoe inserts with lateral wedge support actually supports the patient who have deformity of bow legs of Genu varum in osteoarthritis. In severe stages of osteoarthritis, when the biomechanics of your hip, knee, ankle gets disturbed, the leg starts bowing inwards and it creates excessive stress on the medial compartment of the knee and on your ankle as well. It creates back pain as well. So, the shoe inserts with lateral wedge support actually reduces the lever arm between the ground reaction force and the knee joint, and it helps in relieving the pain of the knee joint. But if the person is having flat foot, the pronated foot, definitely the lateral wedge sole is not going to help. In fact, it is going to aggravate the condition. And so the foot insoles entirely depends on the foot condition. But the knee braces, which comes in so many categories like a normal knee sleeve or some locked knee braces, some hinged knee braces, there are so many categories available in the market. They actually helps in biomechanical correction of the knee joint. And when a joint gets degenerated, it slowly gets biomechanically faulty position. So letting it coming in the correct position is very, very important if you want to really relieve the symptoms of pain and further muscle weakness. So knee braces are going to help, but yes, when the person is exercising, the braces should be removed and the muscles should be targeted to get strengthened so that it will further embrace the joint nicely. Number 4 is cross leg sitting aggravate the arthritic condition. Well, it depends on what is your age, what is your occupation, what is the condition of your back, and what is the condition of your SI joint, your sacroiliac joint. The studies shows that in younger adults, cross leg sitting actually helps in stabilizing the sacrum. Some muscles which are transversely oriented, like piriformis muscle, the muscles of pelvic floor, the transverse abdominis muscles, they actually stabilize the sacrum. And when the SI joint is stabilized, it definitely decreases the load on the knee joint. Also, there is a study which shows that there is no contribution of cross leg sitting over the knee joint pain, especially the anterior knee joint pain in front of the knee joint, behind the patella, कटोरी के पीछे का joint. But definitely in elderly population who are already having joint space narrowing, the cross leg sitting can aggravate the condition because cross leg sitting requires bending of your knee joint more than 100 degree, flexion more than 100 degree, almost 120-degree flexion is required in order to achieve the cross leg sitting. When this posture is adopted for a longer duration, it can further increase the pain, increase the swelling, the inflammation in the joint, and hence the elder population is advised to sit on a chair or on a stool and avoid the cross leg sitting. But if you want to prevent the osteoarthritis in your 50s or your 60s, early 60s, you should definitely strengthen up your muscles and you should adopt cross leg sitting in your early ages. Number 5 and final and very important myth is that, which I really want to break, nothing can stop the progression of osteoarthritis. Like I discussed earlier, there is some modifiable and non-modifiable risk factors. You can definitely prevent the progression of osteoarthritis at any stage. If you are on the 4th stage or on the 5th stage, definitely the conservative management is going to help you, but the surgical management can be a choice of treatment. But that's not the thing that you cannot prevent the osteoarthritis. If from the beginning only you strengthen up your muscle, you put attention on your biomechanical correction, your foot and your body biomechanics, your body weight, your joint flexibility, your nutrition, your state of mind according to your physiological processes, according to your age, you can definitely break the cycle. And so, with this, we will end up our video. If you want to get some information regarding arthritis, regarding exercises which helps in arthritis at different ages, you can definitely comment it in the comment box. Thank you.